Hi, everybody. I am so glad that you are here. You guys, talking about nutrition is like my favorite thing in the world. Yeah, because I talk to so many moms, and every single mom I work with, we have this exact conversation where we're talking through the birth plan, and at some point, the mom, the dad, the partner, someone will say, we just don't want interventions. We want an easy, simple birth. We want this plan to be followed. And I want that for you too. I want that easy and simple and safe birth. But the truth is that sometimes the only place that you can prevent the intervention is 3 steps back by truly, truly, truly nourishing a mother. As modern women and even people, we have a huge problem in that most prenatal nutrition, it is completely and totally outdated, which means that if you are searching Google for nutrition information or even looking in most pregnancy books, what you are finding is not evidence-based information. And beyond that, some of the very things that you are told to limit are the exact foods that you actually need to create a healthy baby. You guys, it's bad. So I am so glad that you are here so that you will know exactly which nutrition is going to create health for you, exactly which nutrition will allow you to build a healthy baby, cell by cell by cell. All right, are you ready? I have so many doctors refer their patients specifically to this class because there is so much more in your control than you realize. And as we go through this and we see the incredible amounts of safety and predictability and reduction in risks that your diet, your exercise, your sleep habits, how you handle stress, your conscious choice to reduce toxins in your life has, you will be motivated beyond belief to take those little tiny steps to cheer yourself on as you make one choice after another to truly support yourself and your baby. That being said, there are things that are out of your control: your genetics, your age, your family history, and how you as an individual tolerate pregnancy. So I beg you, please, when it comes to nutrition, do not use any of this information to beat yourself up or come down hard on yourself. Choose love, choose growth, choose baby steps. Okay? All right. I know that pregnancy, there's a ton on your plate, and it's not ever easy. There is no time in life where it is easy to make changes to your diet because these habits, we have practiced them and they are ingrained in us. Emotionally, they benefit us. Physically, they benefit us somehow, even if it's not to the goal that's ultimately our highest goal, right? And it's easy to think, you know what? I'm taking a prenatal. I'm good. I remember thinking that in my first pregnancy. The truth is that there are a lot of prenatals that are lacking key nutrients. Some of them lack nutrients such as iodine and choline, and others have nutrients that are really difficult for your body to use, such as vitamins that have folic acid instead of folate or L-methylfolate. So yes, keep taking your prenatal vitamin. It does act as an insurance policy, but it is not a replacement or a diet of whole, nutritious foods. With the next few videos, you'll learn how to take control of your pregnancy and make your birth safer by consciously choosing a nutritious life. And you will see that when it comes to pregnancy, the foods you eat, they are going to build your baby cell by cell, your baby's brain, their immune system, their body. All of these things have to be built from the ingredients and the tools that you give your body. So let's choose really good ones. And beyond that, what your foods can do for you is they can help you prevent anemia, preeclampsia, gestational diabetes, preterm birth, and even giving birth to a low-weight baby or a really high-weight baby. You guys, there is safety in food. So let's talk about this. How does what you eat affect your pregnancy and birth? Let's look at a few really, really big transformations that have taken place because of nutrition. Let's start with Dr. Brewer. Dr. Brewer was a pioneer in using whole foods to prevent complications. He spent 50 years studying how proper nutrition could lead to improved pregnancy outcomes. His main focus was on preeclampsia. In his clientele, he worked in a specific area. About 40% of moms were having this difficulty, this challenge, which is really high blood pressure that almost always will force an induction or having to have extra medications during birth to keep it managed, to keep you safe, to keep your baby safe. And he found that if he moved moms to a specific whole food, high protein diet, he could bring that number from 40% of all the women he was working with to almost 0. That's powerful, isn't it? Other researchers wanted to see what else a simple idea of a whole food, high protein diet could do. And when they looked at prematurity, they found that mothers who ate high protein diet could bring their prematurity rate down in a population. We're talking at a population level here, not an individual level. But when you look at a population and you switch them away from the carb-heavy focus of most pregnancies towards a high protein whole food diet, we're not talking at all about like protein powders here. Those do not have the same effect. But a whole food, high protein diet, that as a population, the prematurity rate goes down from 12% to 2%. That's almost all of them, you guys. I know there are some things we cannot control. And have grace and compassion for yourself because of that. But look at the power that you have when you eat good quality food. So why does nutrition help prevent prematurity? Well, it's the same reason it helps prevent other things as well. You're going to be boosting your immune system because you have more foods and vitamins and minerals that you need. You're going to be getting better hydration throughout your body. You're going to have protein that your body needs to create the blood volume, the increased systems in your body that are supporting this pregnancy. You're going to be supplying the body with enough nutrients. When you take care of the little things, the big things often take care of themselves. Now, this is my favorite study on nutrition of all because they took more of, instead of looking at one specific thing, they took a really broad view. And they found that for mothers who were given nutritional counseling during pregnancy, it improved every single pregnancy outcome. You guys, not just one category, not just one thing, every single outcome. Healthier birth weights for babies, not being too big, not being too small, having a baby during the proper time instead of early or late. Fewer cases of having your water break before your labor begins, which is going to reduce your risks tremendously. Reduced preeclampsia, reduced gestational diabetes. And you guys, they followed these families for 3 years. And they found that throughout that 3 years, the babies whose mothers had nutritional counseling and who paid attention to their diet were positively affected all the way through those 3 years. And we'll talk later about the lifelong benefits that nutrition has for your child. You'll see that as we go into exactly what to eat. It is absolutely true that what you eat now can have huge benefits for your child for years to come and for yourself. You can reduce your baby's risk of developing diabetes, struggling with obesity, having chronic skin rashes later in life, just by eating differently now. Most women that I know are ready and they want to make healthy decisions. The only limiting factor is knowing what to actually eat. How empowering is that? That now you are going to have this information. You are going to know where your conventional wisdom might lead you astray and how to adjust that and bring yourself into the ideal pregnancy diet. So jump into the next videos, and I can't wait to help you understand the advice that you've been given before and how to refine that and build on that so that you can eat in a way to build a healthy birth. All right, we'll see you in the next video.